Usually the first thing in the day after I wake up is we go for an exercise. It depends. It might be a walk. It might be a run. It might be to the gym. It just depends on the day of the week. Usually by the time I'm done with the exercise and I'm coming back home, I get the first call from the hospital, usually the cardiac surgery ICU, that's giving me an update on the overnight events of the patients that we had operated on the previous day. After that, we get ready for the day. I have breakfast with the kids and then I drop them off in school and then I head to the hospital. By the time I get to the hospital, the first patient for surgery that day is ready to go back to the operating room. So I say a quick hi to them. I say hi to the families. I review the studies again one last time before they go back. And then I let anesthesia take them back because anesthesia work has to be done. They have to give the anesthetic medications, prep and drip. So I let them do their thing. That's a whole team by themselves. So they will do their thing. In the meantime, I would go and I would round and see the patients in the ICU as well as the patients in the ward, make sure everything is going okay. And usually this is helped by a team of nurses in the ICU as well as nurses on the wards. But while I'm doing that, the physician assistants are with me who have all the accurate information that they come previously and actually gather for me to round. Once that's done, I head to the clinic or the OP, the outpatient department, where usually there's one or two patients who are waiting to see us. And one of my associates or one of the other PAs, we've already seen them, so we meet with them. We discuss what the problems they have and decide on when they need to get surgery. By the time all this is done, the anesthetists are ready for us to get started in the operating room, and we go into the operating room. And it depends on the day. Some days it's coronary artery bypass grafting or CABG, which is the commonest operation. Some days it's a valve, some days it's aorta, some days it's open surgery, some days it's minimally invasive surgery, some days it is off pump, meaning no heart-lung machine. Some days it is on pump, which is using the heart-lung machine. So it depends on the day, what procedure it is. But what is important is that the operation is not a one-man show. As I told you previously, the anesthetic team is a completely separate team that they make sure that the patient is adequately anesthetized. But then once I go into the operating room, there are multiple team members. We have a set of nurses that help me with equipment, clean the patient, hand over the equipment, check things in the chart while we're doing the operation. In the operating team itself, I have one or two other doctors who help me during the procedure. And there's also physician assistants who do the same depending on the case. Sometimes we're all operating in one area depending on the procedure, like if it's an aortic surgery or if it's a bypass surgery, where we might have people operating in two places. One team working on the heart, other team working on the leg to get the vein that we can put on the heart. Sometimes it's three places where we're doing a minimally invasive surgery where I'm actually working on the heart while another assistant of mine is working on the groin to establish cardiopulmonary bypass, while another partner of mine is working on getting the vein. So it depends. It's a lot of teamwork, a lot of coordination that goes in the operating room. It's very intense and very serious, very, very focused work. Once the surgery is done, the patient is taken to the intensive care unit. Usually by the end of the day, when I come out of the operating room, there are a few more patients that are waiting in the outpatient department or the clinic for us to see. And also a few patients are referrals that come in during the day. So me, along with my team of physician assistant associates, we go around, see all these patients, make sure the appropriate treatment is scheduled or done, and then we finish the patients in the outpatient department. Once that is done, I head home. I usually have a little, coffee or a little break with the family before I head to my own clinic, where there's usually one or two patients that I get to see. Once that is done, I head home for dinner and Typically, it's a family dinner. Before I go to sleep, I get usually one more call from the hospital, from the intensive care unit, giving me an update on the surgeries that happened that day. And then, yeah, that's it. And then we call it a day.